So hello friends, welcome to my new video. So today in this video, I will discuss with people about a very important topic that you all should know. So I'm telling about Adie's chronic pupil. So this is the third video that I'm uploading on the pupillary abnormality, where the first video that I uploaded on Horner syndrome, then I uploaded video on Herdner palsy, then it's time for Adie's chronic pupil. So the pathophysiology of this Adie's chronic pupil is quite similar to Herdner palsy, but there is quite little difference in that we are going to discuss today. Okay, so the Adie's tonic pupil, it is a rare eye condition that primarily affects the pupil reactions to light. So in this condition, one or both pupils appear larger than normal and react sluggishly to changes in light. However, they constrict appropriately when focusing on near objects, which is the hallmark of this syndrome. So this pupil abnormality often raises concern, but it's important to note that adistonic pupil is generally not progressive and can be managed effectively. So it is commonly observed in young to middle-aged adults with a higher prevalence in females. So throughout this presentation, we will go in deep into the clinical features of adistonic pupil and the diagnostic process undertaken by eye specialists and the management strategies used to help patients maintain their visual quality of life. So here in this picture, you can see that the right eye pupil is quite dilated manner than the left eye. So why it is happening, that we are going to discuss today. So this is the same slide that I shown you earlier in the third palsy video, where because the pathway is quite similar to that, but we are today going to focus on the parasympathetic pathway, right? So the oculomotor nerve pathway, I told you two pathways here. One is normal, which is innervating the extraocular muscles. Another is parasympathetic pathway, which is giving nerve impulses to the pupillary sphincter muscle and ciliary muscle. So if damage happened to the ciliary ganglion, because of that, the after effect of this condition, which is leading to adistonic pupil also. So this is why the pathway understanding of this pathway properly is very much important, right? So the parasympathetic pathway of the oculomotor nerve controls important functions of the eye, specifically the pupil and the lens. So the journey of this parasympathetic pathway starts from Edinger vesicle nucleus, and this nerve fiber travel through the oculomotor nerve, which is also control the eye movement. So here, passing through the cavernous sinus, which is a cavity located behind the eye, the nerve make its way towards the orbit, and then it enters the orbit through a small opening called superior orbital fissure. So within the orbit, the nerve divide into branches. The parasympathetic fibers travel to the inferior division of oculomotor nerve, and then these fibers then synapse at a junction called ciliary ganglion, which is located near back of the eye. After that, from there, postganglionic fibers extended towards two important muscles, sphincter muscle and ciliary muscle. Now, the sphincter muscle controls the size of the pupil, contracting it to make it smaller in bright light. In iris, there is two muscles, dilated muscle and sphincter muscle. Dilated muscle, if constrict, then pupil will get dilated. And if sphincter muscle constrict, then pupil will get smaller, right? So, and also the ciliary muscle, which is innervated by the parasympathetic nerves. So, the ciliary muscle adjusts the lens shape for focusing on near object, which is the process known as accommodation, that you also know about the name of the process, right? So, now let's continue. So here, this is the clinical feature. Clinical features, first of all, anisocoria means that you can see in this picture that this person right eye is quite dilated manner than the left eye, right? So that we are going to discuss. This is known as anisocoria. That means asymmetrical iris signs, right? Another is light near dissociation. So what is this light near dissociation? So light near dissociation in adistonic pupil is refers to the way the affected pupil respond differently to light compared to focusing on near versus distant target. Normally, when exposed to bright light, our pupil constrict quickly to reduce the amount of light that enters the eye, which helps us to see clearly and comfortably. So, in someone with adistonic pupil, the nerve fiber that controls this response to light are damaged at the ciliary ganglion. So, as a result, the pupil remain larger than normal and react slowly or minimally when exposed to bright light. So, this can lead to discomfort in bright light, right? Because so that the patient will have photophobia symptoms. So, however, when the person focuses on a near target, the pupil constrict more effectively. Why? This is because the accommodative response, focusing on near objects involving different nerve pathways that may still be functioning despite the damage. So, when focusing on a near target, the brain signals the eye to adjust, including constricting the pupil, which allow for clearer vision. So, this response is much better than when the person look at a distant target. So, where the pupil remain less responsive to changes in light. So, in distance, the pupil will get dilated. But when the person will see a near object, then pupil will get smaller. So, this light near dissociation is interesting because it demonstrates the adaptability of the nervous system. Even when the pathway for responding to the light is compromised, the pathway for focusing on near target can partially compensate. So, which is clinically, this is characteristic help in differentiate the aristonic pupil from other conditions that affect pupil size, such as nerve pulses or traumatic injury. So, if in summary, so the light near dissociation in aristonic pupil showcase how the eye can adapt to nerve damage, while the pupil response to the light and distant target is impaired. Its ability to constrict when focusing on a near target remain relatively intact, highlighting the complex and resilient nature of the eye's nervous system. So in this picture, you can see that this person right eye is quite dilated manner than the left eye. Why? Because the right eye, because of any reason, like it can be an infection, because of the herpes infection or any eye injury. If damage happened to the ciliary ganglion area, that lead to damage to the nerve fiber, which is giving nerve impulse to the pupillary sphincter muscle. So because the nerves are get damaged, so the dilator muscles are working very much, and that is leading to this eye is in quite dilated manner. So in dim light also it is dilated. In bright light also it is dilated because pupil is very much non-responsive. And when you will shine a light or shine a light in that affected eye, the pupil, even then also the pupil is dilated. Why? Because the nerves are getting damaged. Because of that, it is quite dilated manner. Okay. And another is like response to the near target. As I told you earlier, that even the nervous system, which is controlling the sphincter muscle, are damaged because of the ciliary ganglion damage. So, because of that, the distance, the pupil is dilated manner. Even after the light, the patient pupil is dilated. But when the patient see a near object, then the accommodation activated. And accommodation also has meiosis, right? There is a classic triad of accommodation, meiosis, and convergence, right? So here, accommodation activates with convergence, and this pupil is constricted manner. But the constriction is not the same constriction you will get in a normal patient, but the constriction will be better than the distant dilation. Okay. And also, when the patient is told to refixate at the distance, the pupil is quite in a dilating manner. If you compare the size of this pupil with this one, it is quite dilated. And when you will put the pilocarpine 0.01%, then this eye, because of it, the effect, dose is very much minimal, this eye is very much non-reactive to that small amount of pilocarpine. But as nerve damage happens, that lead to hypersensitivity of the nerves actually there. And because of that, even you put a 0.01% of pilocarpine, this pupil is in a constricting manner. It constrict because the nerves are getting hypersensitive. So this is known as light near dissociation. Means in light, if you shine the light, pupil is not responsive, but when you will show a close object, then or near target, the pupil will get constricted manner. So that is the clinical feature that you will focus in an Adie tonic pupil patient. Okay. Now I think you understood this one. So let's go now from this slide. Here, mechanism of uh, aberrant reintervention. So what is it? What is aberrant reintervention? So when someone has Adie tonic pupil, it starts with damage to the parasympathetic nerve fiber that control the pupillary constriction. So this damage can result from various causes such as infection, trauma, anything. So the initial effect is that pupil become unusually large that I showed you earlier in the last slide and does not respond well to light, causing issues like glare, discomfort, and that means photophobia symptoms the patient will have. Now, regeneration and aberrant reintervention. What is it? So here, over the time, the body tries to repair the damage. And now you will ask me this question. I know this very well that you will ask me that how this reintervention happening. I will tell you this one also. So the nerve fiber try to regenerate again. So here there is two type of nervous system are there in our body. One is central nervous system, another is peripheral nervous system, right? So the peripheral nervous system, some part of the peripheral nervous system can get regenerated even after they get damaged. But if the damage happens in the central nervous system, they will never get regenerate. Okay. So once the damage happens to the optic nerve or auditory nerve, anything, that damage is permanent. There is no regeneration. But once the damage is in the peripheral nervous system, then some amount of that nervous system try to get regenerated. So here, as I told you earlier, in ciliary ganglion, it leads to damage to the parasympathetic nervous system. Once it is get damaged, so the nerve fiber began to regenerate and attempting to reconnect with the eye muscle. However, this process is not perfect. Instead of restoring the original pathway that control the pupil's response to light, the regenerating fibers often cause new and mixed connections. So this phenomena is known as aberrant reintervention. Okay. So here, after that, if this process, the regenerating nerve can mistakenly connect both the muscles that constrict the pupil in response to light, that is a sphincter muscle, and the muscle involved focusing on the near object is ciliary muscle. Because of this mixed matchup connections, so the eye receives conflicting signals. As a result, the pupil don't constrict when in response to light, but respond better when the person focus on a near target, such as reading book or looking something up close. So here there is a light near dissociation that I told you earlier that when exposed to bright light, the pupil remain large and react slowly. But when the patient shift focus to something nearby, the pupil constrict more effectively. So this happened because the nerves intended to control the light response now also respond to the brain signal for the near focus. So here, there is a tonic pupillary response. So this is why it is called tonic response. So the constriction during the near focus is typically slow and sustained. So which is referred as tonic response. So that is why it is known as tonic pupil. So this low prolonged constriction contracts with a quick reflexive response seen in healthy eye. But yes, now I want to tell you. In this picture, you can see that both pupil in the dark is dilated. Why? Because pupil is letting more light to get into to the eye. In the room light, even after room light, this pupil is constricted, but it is not constricted. It is dilated. Why? Because this eye is affected eye. When you will show the bright light, then this pupil is constricting more. But even after you shine the bright light, this pupil is not constricting because the nerve pathways are damaged. Okay. So after that, in the when the near target, that is leading to accommodation, convergence, and meiosis. So you can see this eye, the constriction, and you can see this eye, the constriction. That it is constricted than this distant condition, but it is not same as the normal. That means, and also it takes quite long time. Okay, it is time consuming. So it is known as tonic pupil. Why tonic? Because it takes time to constrict, slow constriction. Okay, and when you put the pilocarpine, then 0.01 pilocarpine will not lead to so this 0.01 pilocarpine will not lead to constriction to left eye, but it lead to constriction to the right eye because it is more hypersensitive. Okay, so this is what I want to tell you, that aberrant reinvention means once the nerve get damaged, then the nerve try to regenerate again. But the regeneration and reconnection become mixed matchup and it lead to abnormal reaction. So this is the thing actually going on, and where it try to regenerate, then a nerve which supposed to go to the pupillary sphincter muscle, it mistakenly uh, join the ciliary muscle. So that is why when the person actually activate the accommodation to see a near object, as the pupillary muscle are also innervating the ciliary muscle, so it lead to constriction of the pupil. That is aberrant innervation. Okay, I hope you understood this one. Now, there is another thing like Adie syndrome. So I'm not telling about Adie's tonic pupil now. I'm telling about Adie syndrome. So it is a syndrome. Okay. So imagine your body as a machine that usually runs smoothly. Adie syndrome disrupts this smooth functioning by causing damage to some nerve fibers that control things like size of the pupil or certain reflexes of the body. This damage can happen because of things like viral infection or the body's defense system is not working properly. Suppose you got the injury, something else. Okay, so here the signs that you will see is like absence or diminished deep tendon reflex, like particularly in the that means you will have less reflex in your body, as well as sweating abnormality, reduced sweating. Also, you have digestive issues like occasionally gastrointestinal disturbance can also be there, and cardiovascular changes like irregular heart rate, something. So all these things are because of the Adie syndrome. Okay, so it is a Adie syndrome. So it also can lead to Adie's tonic pupil as well. Okay, so now how to diagnose the Adie's tonic pupil? So let's start from the medical history and physical examination. So diagnosing this Adie's tonic pupil begins with thorough medical history and physical examination conducted by an eye specialist, right? So the eye specialist will discuss any symptoms that patient has noticed, such as changes in vision or unusual pupillary reaction. So detailed physical examination also and also detailed history taking will help us to go through the workup very nicely. Okay. Second, pupillary examination. So the eye specialist will carefully examine the patient pupil because in Adie's syndrome, Adie's tonic pupil, the affected pupil tends to be larger than normal and may react slowly to light. However, it will constrict when focusing on a near object. So this unique response helps differentiate Adie's tonic pupil from other pupil abnormality. Another is pilocarpine testing. So to confirm the diagnosis, the eye specialist might perform this pilocarpine testing as well. This involves applying a small amount of dilute pilocarpine. I'm talking about 0.01. So this medication that stimulate the nerves controlling pupil size, that is sphincter muscle, into the patient eye. In aristonic pupil, uh, if you put the pilocarpine eye drop to that affected eye, it will constrict very quickly. But if you put the 0.01 minute pilocarpine to the normal eye, it will not at all constrict. Because in edystonic pupil, the affected eye will have hypersensitive nerve endings. So because of that, even after you put the small amount of pilocarpine, it constrict and it gives you the diagnosis of that. Another is like reflex assessment. I told you about the Adie syndrome. So Adie syndrome often involves like dysfunction of the autonomic nervous system beyond the eye, and the eye specialist will assess the patient's deep tendon reflex like those in the knee or elbow. In Adie syndrome, so these reflexes are typically reduced or absent on the affected side, reflecting border nerve involvement as well. And also, if I tell about the additional tests, so depending on the symptom and examination finding, additional tests like MRI or CT scan may be ordered by the eye specialist. So these imaging tests help to rule out other neurological conditions and provide more information about the nerves and structural things of the body. So blood tests may also be conducted to check the systemic condition as well. And also, if I talk about the differential diagnosis, then lastly, because of the Aries tonic, people can resemble other conditions and neurological conditions. So, eye specialist will try carefully consider the differential diagnosis. So, here, this include conditions like Horner syndrome or pharmacological pupil dilation. So, this step ensures the accurate diagnosis and allows the development of a tailored treatment. So, because of that, this pilocarpine testing and torchlight examination pupil assessment is very much important, where we are looking for light near dissociation, right? So this is the management of Addis tonic pupil. So here, first of all, it is divided into two parts, systemic and monitoring. So systemic here, reading glasses for near task. So here, patient with Addis tonic pupil may benefit from reading glasses to assist with near vision, especially if accommodation is affected. And also pilocarpine drop for light sensitivity, because the pilocarpine drop for light sensitivity is actually I told you that it stimulates the muscles controlling the pupil size. It is sphincter muscle. So can be this drop can be used to reduce the light sensitivity, that is photophobia associated with Addis tonic pupil. And regular follow-up for any associated neurological conditions, since Addis tonic pupil can be associated with neurological conditions such as autonomic dysfunction or other nerve-related issues. So regular follow-up appointments with an eye specialist are very much important, so that ensure any changes in symptom or potential complication are monitored and managed very nicely. Okay. So in summary, I want to tell you that Addis tonic pupil, it is a relatively rare neurological condition which is characterized by the distinct features related to the pupillary dysfunction, border autonomic nervous system irregularities. So this condition typically present with one or both pupil appearing larger than usual and responding sluggish to light. But when you give a near object, then pupil actually constrict, right? So alongside these symptoms, patient often experience various issues related to the autonomic nervous system in case of Adie syndrome. So diagnosis, I told you about the light near dissociation testing by pupillary examination and also pilocarpine test. Okay. So that's also a technology. Please don't forget to like, comment, and subscribe to my channel. Thank you so much.